Great. Thanks, Trey, for getting us together for this chat and review. Starting with cores, I tell you a couple of things I really liked about that presentation. It complemented the MetaLinker discussions quite well. Cores specifically, as a framework, seems to be very suitable and appropriate for casting sort of a wide perspective over a set of very complex operating system. When you talk about how the healthcare system actually functions and operates, a lot of participants, a lot of moving parts, very disparate, different systems, and so forth. And CORE seems to provide a nice framework for assessing, as it says, the clinical and the organizational and the ethical and social aspects of affecting meaningful change by imposing new technology on that system. So maybe as an opening comment, that's one of the thoughts I had to offer. But Carlos, I'm sure you have other more insightful things to say.
No, yeah, in addition to that, like looking at where they are in terms of the development of the system, right, where they have the technology validated in the lab, and now they want to start validating in relevant environments. So when you're moving from lab simulation to the real world, you have to start thinking about what are going to be the issues that you're going to face and be ready for that. So I really like the way that they divided in those groups, from looking at clinical aspects, organizational, regulatory, ethical, and social, and then getting that input from experts to identify what are some of the high-level issues, and then what will be the preliminary, let's say, high-level recommendations that need to be aware of that. And well, with the understanding that this is a starting point, right? So if you look at the issues identified, they are big, they are high level, and then when you start really dealing with those issues, you're gonna face more specific issues or sub-issues that are gonna lead to more specific recommendations. But that's the natural progression of the work in terms of moving forward, right? So you get that start, and then you are better prepared to narrow down and go deeper, especially when you go from a more realistic type of implementation in a real environment.
Yeah, I agree. And there, the rubric that they used, if you will, the tech readiness status, as you mentioned, their current position in that framework is validated in the lab. That's a wonderful framework for both thinking about, planning, and executing research that begins at a very basic level, advances to applied research, and then on to potential commercial viability. So it's nice to see that they're thinking forward in that fashion. What I maybe as a suggestion and thoughts about sort of next phase effort, and I'm sure they're well along the path in anticipating this. They interviewed 11 experts, in a focus group arrangement, and I'm sure they had some highly qualified individuals in these different areas. But then again, that's only 11 experts, attacking a very complex system. So I'd like to see them, expand their source of input across a much broader variety of similarly knowledgeable experts on the one hand. I'd also like to see, and would suggest, that they begin analyzing more deeply some of the barriers to adoption. And blockchain and blockchain technology, as you bring it out into the public marketplace, and certainly we know this, we certainly know this intimately from our experience with artifacts, is the moment you bring blockchain out into the public arena is the moment you face issues of understanding and awareness and perception of risk, and particularly so for applications that aren't crypto oriented, which they're not. Metalinker itself as a concept, as an implementation, is not crypto oriented, but the public has a perception that anything blockchain is tied to Bitcoin and crypto, and this cryptic, very impossible to understand technology. And I think that's an area they're going to want to understand much more deeply as they try to understand what the perceptual barriers to adoption will be, just as the engineers are tackling some of the technical challenges of connecting these different data silos that some of the other presentations talked about.
Yeah, in terms of also recommendation moving forward, MedLinker, when you think about the whole idea, is pretty broad, right? So they're trying to tackle the whole healthcare data kind of exchange and fragmentation issue. But I think at some point, to be able to move forward, you may have to, especially when you go to the next validation phase, you may have to focus in some aspects of healthcare. What I mean by that is that, yeah, there are some aspects of MedLinker, let's say, when you register as a patient and so on, that it's applicable to everything. But then when you go into more specific use cases, you may realize that, I don't know, if you're talking about data related to heart or type of medical records will be different than other type of specialty, or dealing with different types of data, different scenarios, and so on. And I think at some point you may, to be able to go deep, you're going to have to narrow the scope so that you can get a better handle of these specific issues and how to address them and so on.
I think that's an excellent point. What it suggests that this aspect of the CORS assessment is to align itself much more closely with the specific development and first areas to introduce and launch MetaLinker into practical application, and really focus in on these issues, taking this similar approach to a much more focused set of needs and uses. Because again, as we've said, this is a very broad and complex system, and it feels a little bit like boiling, trying to boil the ocean at that top level. So I completely agree with your point, Carlos.
Yeah, and the other aspect you mentioned, there's some echo going on. But the other aspect is you mentioned that you have the experts providing input and so on, but at some point it's good to get input from people that completely on the opposite spectrum, right? Because they are going to be the ones that are going to be using that, right? So not only the users that in the medical facilities that are going to be entering the data, but also the regular patients that are going to, yeah. So they may identify other issues or sub-issues that, if you're just too close to it as an expert, you may not realize that.
Yeah, good point.
That was all fantastic. I mean, if y'all have any anything to say in closing, but that was definitely way more than needed. I think y'all went like 9 minutes, so that was great. I mean, you couldn't have scripted that better. That was perfect for what I know Tori was looking for.
Yeah, and I think we covered everything. It was a good article, and it's interesting because you have 3 that are kind of all related to MedLinker. So it helps us think more about all the issues.
Definitely.
Yes. These are nicely, actually they complement each other. So that I thought might have been the hardest one to do. So these other ones I think are more tangible. Where would you like to go next, Trey?
I mean, I think that dovetails nicely into the MetaLinker presentation. The MetaLinker patient-centric decentralized health identity platform using blockchain technology presentation.
Yeah, let me pull my notes up for that. Yeah, okay.
And whenever y'all are ready, y'all can go ahead and start.
So I can start this time. So this one focus more on the system itself, right? The more like of the technology aspect, how it's implementing some aspects about the use case scenarios, which was pretty useful in terms of understanding the inner aspects of MedLinker and what were the scenarios that were used in this initial lab validation.
Mm-hmm. It did, and a couple of things I particularly liked. Maybe it's not quite. I like the way they presented. I think they did an excellent job of presenting the high level of EMR coverage, and they highlighted that the information that is collected is consolidated in the institutions and organizations, but is isolated from patients. And just thinking about my own personal healthcare medical records, I don't see a comprehensive view, and it's one of those epiphanies where yes of course there's a lot of talk about patient medical records ought to be under control of the patient. The patient wants to have that control, but we don't really see and have that opportunity. So I think it was an excellent presentation of the problem statement, of data silos, centralization, out of patient control, and so forth. So I thought they did a superb job there, and then they segued into what was great to see was a description and explanation of the blockchain platforms, the distributed ledgers that they're using, both at the infrastructure level with Hyperledger Indy, and at the consumer level with Hyperledger, Aries for use by the individual and their personal wallet. So it was nice to see them mix in that explanation of here's the foundational technology we're using. There are alternatives out there and such, but it's good to see what they've decided to build around.
I also like the. There's some echo, and you have to mute Dave. Can you hear that? Okay, now can you hear me, Trey? Oh, okay. Yeah, I also like the demos at the end where you see like in details what they have implemented in MedLinker and how to use them and how they support the 7 use case scenarios that they used in that initial simulation and testing, right? So it provides especially for those who haven't been involved in the development piece, to have better understanding what's the final product, what it can do for you, and what it can't, right? But one aspect, of course, they implemented the 7 scenarios for this initial testing, and of course, moving forward, they're going to implement others as well. And the comment that I made from another paper about they being at some point they're going to have to focus on a certain aspect of healthcare so that they can expand these scenarios to create a complete picture of everything that will need to tackle that aspect of healthcare. And from an IT implementation perspective, a big thing that I know that they've been thinking about already, and it was identified in the course paper, is that the whole issue of we have existing systems, you have existing procedures that the companies like the healthcare providers are using, and so how this is going to be integrated with existing systems to electronic medical records, and start thinking about that part, because there at some point there will be a transition, right? So it's not that the users are going to switch off what they have and transition to a new system. There's going to be a transition in systems, a transition in procedures, in workflows, right? And you have to start thinking about that part as well.
Yeah, I think that's an excellent point, where the practical challenges of technologies like this, being introduced and deployed for probably quite a period of time. What we'll see is, what we as a healthcare consumer of medical services will probably see is very much a hybrid arrangement, where those of us who are more interested and adaptive and willing to use new technology will have our wallet, and that digital wallet will be usable in certain places and not other places.
Mm-hmm.
Somewhat similar, perhaps, to the early days of credit cards, where establishments would accept certain charge cards, but not other charge cards, and there may be quite a long tail of a hybrid arrangement where we're still working, we're still using, our government issue ID and our insurance card in the same conventional way that we currently are, but in other cases not. So I think you're right. There are practical aspects to deploying this that they'll have to adjust. But likewise, I thought the demonstration that they illustrated with the 3 mobile devices and the ability, of a consumer, of a patient, to share and approve use of information, and for the organizations to share and exchange what was allowed by the owner of that information. I thought that demonstration was excellent. I think they have a great basic technology platform to build from going forward. I'm excited to see what their next developments look like.
Yeah, and I was just curious because it was not clear for me from the paper, is that how we're gonna handle things like MRIs and X-rays, or this type of medical records that are not, let's say, data fields that you have in a database. So how are you going to connect to those? And I don't know if they thought about that or not. I'm sure they did. But I was just, yeah, it's more like my curiosity in terms of understanding that piece.
Yeah, well, I mean, we actually look at that at Artifacts. We deal somewhat in that realm where there's always the brute force method of associating an image file, something that's not metadata or not keyable, key entry in. And the most efficient way to accomplish that is to have interfaces with those devices, right? But the moment you go down the path of building direct interfaces with devices and equipment is the moment that you're faced with the marketplace is full of many suppliers of those devices and various protocols on interfacing with them and so forth. And that's where things really do get much more complex technically, and can become a bottleneck to deployment. But you're right. That's an area that for any of us that deal with research information, whether it's medical information that's not textual, but any type of information, that always becomes a bottleneck. But overall, I think, if there were one suggestion that I would make to the MediLinker team is to, although I understand that the current the current model in healthcare is one where a government issued ID, as they illustrated with a driver's license, and an insurance card is the pathway to entry to obtain medical services. I think all of us who work in the area of personal ID management and ID information, I think we need to look beyond government issued IDs to additional services and technologies that that can reduce the opportunity for counterfeit participants in use of systems. And that's not a specific issue in healthcare at all, but I think it's one that this group, since they're so far along in this effort, will want to put some attention to.
That was great. Again, 10.5 minutes. And I would have said, like, I definitely agree, like, with your last point there. I thought that was perfect, articulated very well. I appreciate it.
Yeah, you bet.
And let's see.
All
so
right,
the
where
third,
should we go next?
let's move straight into, I mean, I guess while we're on the MetaLinker thought train, we can go into the last video in that folder, the designing a blockchain application for patient identity management, or improving, it's called improving transitions of care, designing a blockchain application for patient identity management, submitted by Mustafa Abdul Mohith.
Yes, yes. Okay.
And we can go ahead and get started whenever y'all are ready.
So Dave, you can get started.
All right, sure. Thanks. So blockchain applications for patient ID management. I personally think it's a very suitable technology for addressing the needs in patient ID management. I think the presentation did an excellent job of describing the problems of data siloing, and particularly the barriers and the inability to port data. Lack of portability, I think maybe was a term of art that they used. Those problem points were very clearly articulated, and they had a nice description, a nice concise description of the applicability of blockchain to this use case. And of course, the audience for this symposium is much more knowledgeable about blockchain than the average person walking down the street that you find in a restaurant. But I think describing the basic suitability did a nice job of laying the groundwork for this. And they spoke about permanent and current data on a trusted network, and the sharing of trusted data was nicely described. Of course, a challenge there is to be able to articulate or describe how this trust is actually maintained. And that becomes a double-edged sword, because if you go down the path of technically explaining how trust is accomplished in blockchain, is the moment that people's eyes glaze over, particularly consumers' eyes can glaze over. But so they asserted that. I don't know that they actually proved that point. And I think as they anticipate going to market with a service, that's going to become a discussion and a set of points that they'll want to incorporate into their description, their explanation, and their pitch.
Yeah, other nice thing that they did in this the video was a high-level description of what they've been doing in terms of this initial validation, the simulated scenario, where they look at the 7 unique, let's say, activities to be called cases, and considering 5 different locations, so that you can have a variety in terms of applications, and high-level explanation of what they did and the results that they got in terms of user surveys after using the system in the simulation, simulated environment. So at least to give an idea of the potential of this technology, with the understanding that, yeah, we're still in that initial validation stage. There's many more issues to tackle later, but at least helps point to the right direction. And I think also from a user, it's very important to know that the development of this technology and the system, it's really following a very, let's say, scientific and rigorous process, that it's not something that you're doing that to put a product in the market and make profit right away. No, that you're really trying to understand what are the issues in a systematic way. And I think they did a very good job doing that. Yeah, and some of the comments that I have related to this particular paper was actually something that was covered in the other publications, right? So I thought I should have provided more information about the technology, the information architecture, what kind of data specifics about the data structures and so on, and the integration with other systems. But these were something that was addressed in that other paper that focused more in the technological aspects.
Yeah, no, you're right. What I appreciated was the effort that they put into understanding, studying and understanding the level of data accuracy, and that's always a challenge, when, regardless whether it's a well-established organization with policies and procedures and checks in place. You never get 100%, and you certainly don't get close to 100% with end user consumer input. And so an area of study, an area of research that I think this use case will benefit from, especially in the area of patient input, are the potential applications for machine learning and artificial intelligence tools and technologies to be incorporated to in real time, in the background, be running checks and validations and potentially even presenting users with prompts that catch potential errors in the very, at the coalface of where some of this information is coming into the system, which is an individual who's entering it, on their mobile device, or on a pad, an entry pad that sits in a physician's office. So I think some very, and I think those tools as they relate to keystroke information entry are really quite advanced, and maybe don't even qualify as machine learning or artificial intelligence, but nonetheless, I'll throw them under that under that category. I think that's an area that they're going to want to spend more time researching and identifying some of the tools and applications that are worth incorporating into the ecosystem of what they're building.
Since you mentioned AI and machine learning, that's something that like in the long term, once all of this is put together and you have that ability to integrate all that information, that will really gonna allow us to maybe to cross-reference the data and learn much more about what's going on than what we know today, right? But that's a long-term goal.
Yeah. Oh, tremendous. There's tremendous kinetic potential there, isn't there? Yeah.
Definitely. That was great too. It's a good place to stop. It was 7 minutes, 30 seconds. Yeah, and that was perfect again. The last one is the decentralized identity management for virtualized healthcare by, I'm not sure who this is, but y'all have that pulled up?
Yes. Yes.
Perfect.
Yeah. So
So yeah, y'all go ahead.
Yeah, I can get started on this one. So these the talk about decentralized ID management, and well, it started with a comprehensive literature review of what's the state of the art, the state of the practice on this particular topic, and kind of mapping that to the healthcare sector and why this topic is important and relevant to healthcare. I also mentioned about well, some of the initiatives going on in terms of developing standards by, for example, W3C. And then more specifically, they identified a few solutions for decentralized identification management, some from the private sector, some more researcher. And then they use criteria from a study that was developed to do that evaluation of that of those solutions that they have identified, and then score to see where we are in terms of what's out there and how do they meet the criteria, so that you can identify the strengths and weaknesses, and that's something useful. You see that it seems like the area that they scored the lowest was interoperability, which is something that yeah, we know it's a challenge, so it kind of reinforced all of that. So it gives some more information in terms of what's out there and what are some of the high level issues, so that then we can move forward. One thing in terms of for the article itself, it would be great if they could talk a little bit more about what they plan to do next, right? Because it's like a background review of probably a larger study, and I was curious to see where do they want to go from here. Is it something that they want to develop their own solution, or is it something that yeah, they're just looking at what's out there and then going to implementation, or if they are trying to look at other issues, or go deeper in some of these issues that they identified?
Right. Yeah, I agree. They're going forward. Their work could branch off in several ways. I think it's always ideal to start with a comprehensive literature review. It was hard to see, though, how comprehensive that review actually was, and I would, given some other work that Artifacts is focused on, I would, I'm guessing here because I didn't see it presented within the talk, but I'm guessing that the literature review was what I would describe as it grabbed some of the low-hanging fruit. In other words, the readily available literature that is found in the available indexed and literature databases, whether it be PubMed, whether it be Web of Science, whether it be Scopus, and so forth. And those are wonderful resources. Don't get me wrong. But I do think, and I would suggest a deeper look into the literature. And here I'm broadly defining the literature to include a much broader and deeper view of the gray literature, as well as a wider and deeper view of the lay literature, because from some of the work that I'm working on with another team, the emergence of the application of blockchain technology in the area of healthcare, the application of healthcare at the clinical level and the conduct of healthcare research. There's tremendous amount of information that's below the waterline of what we see in the index literature databases, because it's still early stage, it's emerging, and such. And so from a literature review perspective, I think there's much more to be learned by going deeper. Now, that said, their interest may instead be to pivot and focus on more deeply and at a much more technical level on the DIM solutions, both that they identified, the 6 examples that they presented, as well as others. And if they decide to go down that path, I think that's a very fertile area for further exploration. I'd have to say, though, that I was left wanting, while I did understand the criteria for identity management that they applied, the scoring really wasn't all that differentiating. And there was no way to get behind, the pluses and minuses and so forth in the display itself, or the number ratings that were attached to them. I'm not challenging or questioning those ratings. I think there's a lot more to be learned about how those various systems compare on those different criteria than what's presented there. But I understand that's the limitation of the presentation of this. But that may very well be, Carlos, to your point, that may very well be the area that they're really most interested in going next. But they didn't give us any insight to that. So that'd be interesting to learn.
Yeah, and I agree with your comment about when they score from that 0 to 3, it's very subjective and it doesn't give a lot of insights in why is that a 2 or a 3 and what can you learn from that, right?
Right.
The other, also reinforcing your point, so whenever we do research in technology-related research, things move really fast, right? So, and as you said, when you go to academic publishing, and I mean, it takes time to go to review. By the time that it gets published, that in many cases that's already outdated, right? So, and the other thing is, you learn also with what's happening in other sectors. So it's going beyond just the healthcare and learning what's going on in blockchain and in centralized identification management in other sectors also help bring into your domain.
No, I agree. And it would be, they did, the references they made to the standards, WC3 and other formulations that are coming to the fore, I think is helpful. It would be, I think it'd be pretty exciting if they, if their team or they collaborated with a group to really take a going forward look into what the implications and opportunities and risks are from both some of the standards that are immediately emerging or have just emerged, as well as to draw from, because they seem to be very well connected with various committees and study groups and such, to look forward as to the implications of some of the discussions that are underway about following standards and protocols and so forth. I think that's certainly a fertile area for research. It's not necessarily my core competency, but they seem to be well suited to take that type of a look. I think that would be a valuable perspective to gain.
Yeah, especially if you think about that, they highlighted interoperability as being a big issue, and we know that it is. And one way, or maybe one of the best ways to deal with that, if you can define standards at certain levels, that can really help with that.
Yeah, really good point.